Hello. What's up, everybody? Hi, Consuela. How are you? Hey, everybody. Give a few more minutes for folks to join, but I have one of my favorite topics today. I love to talk about prep. So we are going to be talking about some of the myths and debunk some of those myths about prep, but also talk about, how we can get access to that if that's something that interests you. So let's give people some time to join and we'll get to it. I do want to point out that we are open for symptomatic testing and treatment for COVID-19. So if you are interested or need those services, you can call us at 202-797-4439. And we could possibly set you up with a same or next day appointment. So also, if you need additional pharmacy resources, you can visit us at whitmanwalker.org/pharmacy. All righty. Hey, we're getting some more. So again, I'll be talking about prep today. So if you have any questions, feel free to drop them in the comment box. I will address them as we go along. Um, I will be, talking about the myths that I've heard, help clear up some information that's been put out there in the atmosphere, and also let you know about some of the resources that Whitman-Walker has for prep. And so, if you don't know, my name is David Wilson. My pronouns are he, him, his. I'm a Whitman-Walker influencer. And so, this is why I'm here talking to you about prep today. During the last few months, our community health department, we have expanded our outreach efforts to social media. And so we cover various topics about HIV, STI, sexual health practices, access to care, social determinative health, as well as general public health interventions. And so our next series of outreach sessions, we focus on the current pandemic, COVID-19, and ways that you can manage your sexual, personal, and mental health. I want everyone to know that our community health team is here to educate and support you. Hi, Lisa. Thanks for joining. Hi, Lando. Um, that's a good question, Consuela. So before we jump in, Consuela started off with a good question. So I'll first explain what PrEP is, and then we'll come back to Consuela's question. But that question was, are trans women good candidates for PrEP? So I'm going to pause that question, and we're going to revisit that after I explain what PrEP is for those who may not know. So what is PrEP? So PrEP stands for pre-exposure prophylaxis. PrEP is an HIV prevention method that greatly reduces anyone's chances of becoming HIV positive. So I think that actually answers your question, Consuela. So if you identify as trans, then you also are a good candidate. So it's a good candidate for anyone who has a concern or engaged in sexual practices that may increase their risk. I'm on PrEP. I take PrEP as well, so I'm pretty familiar with it. So there are two drugs that currently have FDA approval as PrEP. And so those two drugs are Truvada, which is probably the most popular since it's been around the longest. And then you have Descovy, which is the more recent FDA approved drug. So some people get these two things confused. So I do want to separate. So you have PrEP and then you have PEP. So PrEP, again, stands for pre-exposure prophylaxis, whereas PEP, PEP, stands for post-exposure prophylaxis. So PrEP is a preventative method that greatly reduces your chances of becoming HIV positive before any possible exposure to HIV. So when PrEP is taken every day, it can be at least 92% effective at stopping HIV transmission through sexual intercourse. The idea of PrEP is similar to birth control. We take birth control to prevent pregnancy. You take PrEP to prevent that exposure to HIV. So PEP, on the other hand, is a 28-day course of antiretroviral medication that can prevent a person from becoming HIV positive after the exposure. So it must, that PEP regimen or that PEP 28-day plan, it must be started within 72 hours of a recent HIV exposure. And it should only be used in emergency situations where someone thinks they've recently been exposed to HIV through sex or needle sharing or any other possible exposure methods. So PEP is more similar to Plan B in the sense that you take you start that regimen after the exposure, similar to like Plan B. If you think you had unprotected sex or whatever the case may have been, you take that after the fact. So that gives you some context of how to think about PrEP versus PEP. If there are any questions about that, please drop them in the chat. All right, so there are always common myths about PrEP, and so we want to talk a little bit about those. One of the things I've heard is, does PrEP treat HIV? So I want to clear that up a little bit. So the medications used in PrEP are part of a complete HIV treatment regimen, but PrEP does not treat HIV alone. So PrEP itself is a preventative method for folks, or prevention method for folks who are HIV negative and who have a greater chance of becoming HIV positive. So PrEP can be up to 99% effective at stopping HIV if it's taken every day. So keep that in mind. If it's taken every day, it can be up to 99% effective. Some people even get up a little bit of the mix-up between its PrEP's efficacy. So as I mentioned earlier, it can be at least 92% effective. Some studies say it's at 99%. So let's clear that up a little bit. So again, at the minimal, if it's taken every day, it could be 99%, 92% effective. However, studies have shown that if you take PrEP 7 days a week, the estimated level of protection is 99%. And so for sexual transmission through rectal tissue and men who have sex with men, those are the type of numbers that we are thinking of. 99% efficacy for men who have sex with men through anal intercourse. So much studies are still needed to determine the exact protection for vaginal or cervical tissue transmission. So TBD on that. I can't actually give you the efficacy rating or numbers for those particular transmission ways of transmission. So what are side effects? I always like to start this off like I take PrEP and I had no side effects at all. I might have experienced a little bit of bloating like the first week, but that could have just been my diet at the time. I don't know. But what are some of the side effects? Again, I never had side effects. Most people do not report any side effects. So about 10% of people who take PrEP experience some mild side effects. So within the first week or two, maybe you know, similar to my experience when they are taking the pill daily. So some of those examples could be nausea, diarrhea. You may experience headaches. Again, I haven't experienced those. So those people who have experienced those, they were reported to go away quickly. And so a small number of people that take PrEP may experience some changes in their kidney and function as well as their bone density. But these side effects are not very common. So for PrEP to work, folks must follow up with their doctor. That's the most important thing. Most important thing. You have to follow up with your doctor every 3 months and you complete lab work. So the lab work includes a metabolic panel, which that basically means they take your blood and it gives you different areas this test analyzes different metabolic panels within your blood. So, for example, if you are experiencing some kidney issues, you'll be able to see that on kidney function issues. You'll be able to see that potentially identified on that panel. And so the lab work includes a panel. It helps you monitor the status of and function of your kidneys. So if any changes were to occur to the way your kidneys are functioning, you would know, and appropriate actions can be taken. And if needed, you could stop PrEP. Someone said that's so unhealthy. Oh, why, Consuela? So how to get started? If you are interested in getting started, you can start with just a conversation. And that conversation should be initiated with your primary care provider or an HIV testing counselor to determine if PrEP is right for someone. Consuela, yeah, so again, less than 10% of people who take PrEP has experienced those type of side effects, like, kidney issues. Again, the metabolic panel actually helps you identify if you're experiencing any of those. So if that were to happen, you and your doctor can have the conversation of coming off of PrEP before there's actually kidney failure. So I wouldn't say that PrEP gives kidney failure. It can definitely have an impact on kidney function for some people, but that's a really, really small population. Again, a requirement for you to be on PrEP is to go see your doctor every 3 months, have that panel taken, and you'll be able to monitor your kidney activities. So I wouldn't say PrEP will lead to kidney failures. However, 10% of the population that we know that has experienced those people have had some kidney function issues. And when they come off the drug, they usually go back to normal. And so I do want to add that. So back to getting started. If you are interested in getting started on PrEP, again, that conversation occurs with your doctor first or HIV testing counselor to determine if PrEP is right for you. If you decide that you would like to begin PrEP, you should schedule an appointment with a medical provider and do so, that's what you do. You schedule an appointment and they can walk you through the process. So again, I do want to point out that PrEP reaches its maximum protection for receptive anal sex after 7 days of daily use. So if you are just starting a PrEP regimen, you want to make sure that you've taken that pill every day, 7 days consecutively before it reaches its maximum protection level. Now, for vaginal sex or injection drug use, the recommended approach is 21 days of daily use before you receive that maximum protection from the drug. So, yes. How about if you don't have any health insurance? Amazing question, because I'm going right into that now. So, what is the cost of PrEP? The cost of PrEP, and I hate when I say this, but it's true. The cost of PrEP varies. It depends on your insurance. So to answer your question, what if you don't have health insurance? Good question. There are resources if you don't have health insurance. So The cost of PrEP does vary depending on your insurance status and what your insurance plan may cover. So if someone is insured, most insurance plans, both public and private, they generally cover PrEP. But that monthly out-of-pocket cost can change from insurance plan to insurance plan, person to person. It just really depends. But if you are interested in PrEP and you have some questions about whether or not your plan covers it, you can call Whitman-Walker. So we have insurance benefits navigators. So you can call our insurance helpline at 202-745-6151. It's a great resource to speak with anyone in, public benefits, and they can help you navigate the options to enroll in an insurance plan, or if you have insurance, help you identify what that cost will look like for you. Someone can also contact, if you have insurance, you can also contact your insurance plan member services about specific out-of-pocket costs. I typically do this on an annual basis because I take PrEP and my plans change based off of my employer's plans and what they have available. And so I typically call member services to get an idea, like, am I paying a deductible this year? And, all that stuff. So you can call your health insurance provider and get those details from your plan. But my favorite part of all of this is that there are assistance programs. So Gilead, who's the maker of Truvada and Descovy for PrEP, they actually have programs for individuals who need help paying for PrEP. So whether it be a person who has insurance but needs copay assistance, or a person who doesn't have it at all, there are Gilead programs, assistance programs that'll help you pay for PrEP. For example, I am on a high deductible plan because I am cheap. It's cheaper to pay for that plan. However, Gilead will cover my deductible. So for example, I had like a $1,500 deductible. I think they covered that for me this last year so that I could continue my PrEP regimen without coming out of pocket. So there are resources if you have insurance and don't have insurance that can help you get the coverage that you need. So do you have to have health insurance to prevent HIV? That is a very good question. I would say no. So PrEP is just one option, right? One option to help you prevent HIV. You can use condoms. There are other ways to practice safe sex. So do you have to have health insurance to prevent HIV? No. Does it help? Absolutely, because you can have access to more. I mean, it is a resource. This is why Whitman-Walker is here. If you do not have health insurance and you are concerned about your risk for HIV, please give us a call and we can help you navigate that. We can help you get, public benefits if that's what you need. If you're interested in PrEP, we can set you up with, resources to help you navigate that space. So do not let health insurance be the blocker for you getting the care that you need. We are here to help you get the care that you need. But great question, Consuelo. Keep them coming. You are having the best ones. Thank you. Do I have to take the pill? So a lot of people think they start PrEP and they have to take the pill for the rest of their lives. No, you do not have to take it for the rest of your life. You can start PrEP and stop PrEP. What I encourage and what we encourage at Whitman-Walker is that you have this conversation with your medical provider. So the decision to stop or start PrEP is definitely a personal decision. And if you are considering stopping, talk to your doctor. There are multiple reasons why a person would want to stop PrEP. They could be entering a long-term monogamous relationship with an HIV negative partner, or they could be with a partner who is living with HIV but has achieved an undetectable viral load. So this is to say that, a person who's undetectable they have, you know, adhered to their antiretroviral treatments enough that they have an undetectable load count in their blood. So I'll talk more about that shortly. But these could be some of the reasons why someone would want to stop PrEP. Again, I encourage that conversation to happen with your medical provider. I'm a PrEP pledge model, just asking questions for the trans community. No, this is amazing. I appreciate your questions, Consuela. Let's keep them coming. I mean, look, I will share the knowledge if I have it. But yes, I do think that PrEP is assumed to be for cisgender gay men, and it's not. It can be for heterosexual, men and women. It's just, it can be for anyone. And so I don't want anyone to feel limited by that assumption, right? But thanks, I appreciate your question. So what happens if you don't take the pill daily? So depending on the number of days that someone has not taken the pill, it makes sense. Your protection decreases. So in general, the more consecutive days that someone misses it, then the lower level their protection is. And this is why we encourage you to take the pill every day, so that you can guarantee that you have that maximum protection. If you miss days and you miss multiple days in it, it gets less and less. I guess your coverage is less and less, and then, you increase your risk a bit. So one of the key questions I hear a lot is, if I am in a relationship with a person who is living with HIV, but they're undetectable, do I have to take the pill? Again, this is a choice that is completely up to you, but I do want to share some facts here. If someone who is HIV positive and they have an undetectable viral load, that means that this person essentially has no risk of transmitting HIV through sex. So PrEP is not necessary to prevent HIV when a partner has an undetectable viral load. So to answer that question, no, it's not a requirement. It's not, but it's really up to you. If you feel more safe and comfortable being on PrEP, then that's a personal choice of yours. But yes, it's not, you are totally safe. If there is I would say that there's very limited risk of HIV being transmitted from a person who has an undetectable viral load. That's what I'll say there. All right. Whether or not someone chooses to trust their partner is highly up to them. That's a personal decision. I said that. But PrEP can be an excellent option to prevent against HIV transmission. I mean, that's the bottom line. If you are, interested in it, then it's definitely that option for you. All right. And so one of the more recent topics I've seen kind of float around, I was in a chat room a few weeks ago, and I came across a post where, a group of men were discussing PrEP 211. And so this is a method that is starting to gain a lot of traction, and people are talking about it. And, so I want to talk a little bit about what PrEP 211 is. So what is PrEP 211? So rather than taking Truvada, once every day like we recommend, PrEP 211 involves taking PrEP medication around the times of anal sex instead of that once per day recommendation. So PrEP 211, it is named for its schedule, for the dosing schedule. So essentially you take 2 pills 24 hours before sex, then 1 pill 24 hours after that initial dose, and 1 final pill 24 hours later. It sounds a little complicated, right? Exactly. So if you have sex more than 24 hours after taking your first dose, over multiple days, you will need to continue taking that 1 pill every day until you have taken 2 doses to continue taking 1 pill. So it's an extremely complicated method there has been studies about this method. I will say, if you research, you can find studies about the PrEP 211 method. This is what I'll say. Is PrEP 211 a recommended method? There are plenty of, doctors and physicians who would tell you that they would rather you have their patient take, PrEP every 2 days or every, 3 days than not take PrEP at all. I mean, definitely taking it some is better than not taking it at all, right? So some doctors would say it's better than nothing. The important thing is to have that medication in your system. So even if that's not on a daily basis, it's still good to have it in your system. However, there are not enough studies to prove the efficacy of the PrEP 211 method. So at Whitman-Walker, currently we are not promoting this method. There needs to be a little more research. So for now, we are still encouraging people to take it daily and to have a discussion with their medical provider if this is a method that you are considering for yourself. Yes. All right. Just want to make sure I didn't miss any questions. All right, it doesn't look like it. So I do want to encourage you to follow us on Twitter, Instagram, and Facebook at Whitman-Walker. You can also follow us at Real Talk DC. You can follow me on Instagram at Sir_Dave_. I want to wish everyone well. Stay safe. Try to stay physically distant as much as possible. Stay in quarantine as much as possible. We are still fighting this pandemic. And so, again, we are available at Whitman-Walker for testing. You can always give us a call if you are interested in those services. And I have the number pinned here at the bottom, so you can get that. That's all I got. If there are no more questions, I do want to thank Consuela for all the amazing questions and representing for our trans partners. We appreciate that. And so thanks. That was the session for today. Have a great one.